Okay, welcome back to Jay Gray Channel here. Today, I'm going to talk about just some things people ask. Okay, these are questions everybody's been asking me that they want to know. Just some simple things that may help you on your journey. Things you may need to know. So I got a little list of things that I've been telling people. Number one, find out what your insurance costs. Find out everything that you can get done, what it costs, or how much of it they will cover. Okay, right off the bat, that will help you. You can ask to actually get it itemized to have a really good idea of everything that above insurance you need to cover yourself. Okay. Now, it is tough. It is ridiculous expensive to get dental implants. I mean, just to get dentures is crazy expensive these days. So, okay, and then second thing, find out if you're going to be needing any bone grafting or surgically getting any infections taken out. Now, when I had mine done, I had a large infection pocket. Okay, that's what actually started kind of getting at some of my teeth. I had a big pocket of infection above them and killed a lot of the roots. Okay, so I had to have that surgically taken out, where they went in there and did what they call a scrape. Okay, so I had to have that done. Now from that, from the infection being in there, right after they did that, after they scraped the bone, they did bone grafting, and that thickens up the bone, so you're able to be able to take, so the bone thickens up, so you can put in more dental implants. So you need to find out if you're going to need something like bone grafting or what have you, infection scraping, because that's going to help you. It can save you months and months when it comes to the amount of time that you're going to be healing. Okay, so if you go in, get your teeth taken out, get your bone scraped if you have any infection, and get bone grafting done all at the same time, that you're going to save yourself a whole nother procedure or two, and plus months of that you don't have to wait, that you can have this all done at once. Okay, all right. You want to go through and you want to find out what type of procedure. A lot of people are looking into getting, say, all on 4, all on 6, all on 8, mini implants. I don't know much about those. I'm actually very excited because I see some people are starting to make videos about mini implants, and that's something I don't know a whole lot about. So when you go in, for the most part, they're going to want to give you something more like I have, where I have 7 implants straight up and down on the top, 5 straight up and down on the bottom. The most implants that they can fit in there. Okay, you want the biggest, most, you're the thickest, most posts that you can get in there. Now, all on 4 is a great procedure. Okay, for a number of reasons. For the most part, when you go in, they're going to give you something more traditional like I have. Now, if you have thinning bone or other issues, you usually get the all on 4 because it's less invasive, and it has opened the door so many more people could get dental implants that couldn't have them before. So it truly is great. So get educated on exactly all the different procedures, how many implants you're going to need, because keep in mind, just for a regular implant, not mini implants, but regular implant, you're talking anywhere from $1,100 to $1,700 per implant. That's just to get them. That's to order them. You know what I mean? So gives you a good idea of where to start. And what else did I write here? All right, and another thing to find out if you're going to get teeth in a day, like many of these places that do all on 4, or some of the bigger name, maybe the chain places, or maybe some of you have heard of doctors where you go in, they pull your teeth one day, put the implants in. You wait the next, the next day you go in, get your teeth put in. You need to find out if you're a candidate for that, or if the place that you go to does that, because I didn't. I went through a dental college, so I didn't get that procedure. What had happened, I had a very long, well over a year and a half process where I actually had to have dentured teeth made, because it was going to be that long of a time from the time getting my teeth pulled to getting the dental implants in with teeth on them. So you need to find out, are you going to get, and get educated, because usually you get, you go in, you get the procedure done, you get teeth in a day. Now, you're still going to have to come back within, I think it's 6 months or a year, where you come back, and the teeth that they originally give you are temporary, and then you come back and get something more titanium reinforced, okay? So, and it helps with the healing process. So, just so you know. You got to you really do have to educate yourself a whole lot. I mean, there's things that I couldn't even fathom understanding. Let's see what else I got here. And basically, I'm finding out, I wrote on, I answered a question back to somebody here saying, find out if you're going to need to get dentures and if you're going to need to pay for them. These are all things that you need to itemize out to figure out if you can afford them. So, it's things like that. Okay. Next is find out how many appointments you're going to need, and try to get them set up, and also find out how many different dentists you may need to see. Some places don't do it all. Sometimes you have to go to oral surgeries. Sometimes, I got lucky. My dentist did it all at the college with, the head guys that had decades of experience in the field. So it really is something you need to look into. Okay. And just try to get a grand idea. You can never do too much research. You can't. And don't get set on just trying to, find a certain person or whatnot. Find out who does what. I tell people, I looked at it like this, and this is how my dentist told me. There's a lot of dentists that do dental implants. There's a ton of them out there, okay? But you might want to look into somebody who's a prosthodontist, somebody who has the 3 to 4 years extra training on top of, post grad. So they'll go to college, then they'll go to dental school, then after that they go to grad school, which they can do a fellowship to do surgical residency, which is kind of sometimes makes the difference. It's the difference of kind of like almost any doctor, medical doctor can do plastic surgery. All that they have to do is be able to get privileges at a hospital. A radiologist can go do plastic surgery tomorrow, as long as he has privileges at a hospital. However, you're going to probably want a fellowship surgeon to do your surgery. So it's the same thing with dental, okay? So just that's something to keep in thought, all right? So when you're going through and you're trying to find out how much all this costs, how to itemize it all, and all that. So now, like I said, you can go travel around to Mexico, and there's other people who have videos about that you can definitely look in on. I don't know much about that. There's a wonderful girl. I do not have her video up here. I think it's something like June Penny. She had a wonderful video up about traveling to get dental implants. So you might want to look into that. Or you can go through like a dental college like I did, which will save you a tremendous amount of money. It really will. It does take a little bit longer. It does. You're not going to get teeth in a day, but I am telling you, it's a great deal. I saved a good amount of money. You have to look at with all the different options they have out there. It's anywhere from what's it, 35 to 75,000 you can pay for teeth. So you want the great people to do it, but you don't want to pay that great ridiculous price. Okay. So you look into the quality, but also you also have to see what's affordable. All right. Thanks a lot.